Good evening, everyone. My name is Laura Gomez. I am a quality assurance specialist with the Bureau of Developmental Disability Service through the Department of Health and Welfare. And I am here today to speak to you guys about the different services you'll have available when your student transitions into adult services. This evening, we're going to be touching on how to apply to or for developmental disability services and the different types of options available. Okay, so right now I am sharing my screen, and this is part of the packet available to you guys in the material link. Um, the the form that I have pulled up right now is the road to transition guide, and I am on page 4 of that guide, and it is how to apply for Medicaid. Medicaid application, what is it and why do I need it? Now, this is one thing that I've noticed that a lot of people find a little bit confusing. I am with the Department of Developmental Disability Services, DD services. I'm going to refer to it as DD services moving forward. But in order to have adult DD services, you must first have Medicaid. Medicaid is what pays for the waivered services. Okay, so like I mentioned, to receive developmental disability services under Medicaid, you must first apply for Medicaid health insurance. The health insurance is what pays for the DD services for adults. You can apply for Medicaid 30 days before turning 18. You can apply online, by mail, by phone, or in person. You can find your local office by calling the 1-877 number on the packet, or you can call locally at 208-334-6700. Now, when you make these calls, you may have to leave a message and they will call you back. In the message, you want to let them know that you are applying for adult DD services, but you need to apply for Medicaid first. If your child currently has children's Medicaid, they can remain on children's Medicaid until the age of 19. But here's the catch. In order to access adult DD services, you cannot access adult DD services on children's Medicaid. You have to be on adult Medicaid, so you have to apply for adult Medicaid, all right? Now that we've talked about how to apply for Medicaid, let's talk about the process of applying for DD services. Now I'm gonna go to page 7, and I'm gonna do a little jumping around here because we're not gonna touch on everything in the packet. I would suggest that you guys take the time to read the packet on your own time. It is full of very important information, a lot of detail, but we are going to touch on a few points, okay? So like I said, I'm going to turn to page 7. DD services, how do I apply? You can apply for these services 3 months prior to your 18th birthday. So 3 months before your child turns 18, you can submit the application, and we'll discuss the application a little in a few minutes. No more than 3 months. If we receive the application more than 3 months before the 18th birthday, it's too early. We'll just have to deny it, send it back, and ask you to reapply 3 months before their birth date. With your application, you should include your most recent records. So don't submit documentation that is too old. Some people submit documentation going back to infancy. We don't want that. We don't need that. We just need the application itself, documentation confirming the developmental disability. And if the disability was identified before the age of 22, an example of the records that you can submit are school records, doctor records, nothing too old. the most recent record should be enough. And this whole section will give you more detail on what type of things you can submit along with the application. I'm going to turn to page 9, which talks about SSI. All right. So first thing you need to know about Social Security income. You do not need to have Social Security to access DD services. But there are a few things that you should consider. The DD waiver or DD services do not pay for room and board or any extras. Currently, some children receive Social Security, but as a child, you apply under your parents' income. At 18, you are your own household. Okay. Even if you still live with family, you're not working. If you're not working, your income is 0. And of course, that's important information. Now, knowing that, you don't have to have Social Security, although having Social Security income is helpful. If you choose to apply for Social Security, you can call 30 days before their 18th birthday to make an appointment to talk to Social Security and get qualified. And of course, you would be calling the Social Security Administration. Now, at this time, most people who apply for Social Security also apply for Medicaid. And this is where I find that some people get a little confused. If you recall, to apply for DD services, you have to apply, you can apply up to 3 months before the 18th birthday. To apply for adult Medicaid, you can apply 30 days before. So at the time that people apply for Social Security for their child who is turning 18, most people choose to apply for Medicaid at the same time, 30 days prior. Okay. We don't touch too much on Social Security because, of course, that's not our specialty. We just know the timelines, 30 days prior. You don't have to have it in order to qualify for DD services, but the information is there. Okay. Now we're going to move to page 11 on the transition, a road to transition guide. Eligibility. Eligibility and budget. How do I find out if I'm eligible? Like mentioned prior, 3 months before you turn 18, or if you're already 18, you submit an application. By we, I mean my department, we process the application and then we send that application along with any supporting documentation that you submit to our third-party assessor. Currently, we use Liberty Healthcare. That third-party assessor reviews the application and calls the number on the application to set up an interview. At the time that they call to set up the interview, if any further documentation is required, they'll let you know at that time. They call you, they set up an appointment. During that interview, the assessor completes a functional assessment. During that appointment, you can have someone with you, and by you, I am talking about the person who is being assessed for services. So they can have a trusted person with them, whether a friend, a family member, someone who can help them answer questions if they're having a hard time answering some questions. The family member or friend can help. Now, once the assessment is completed, the results of the assessment are determined. The assessor will determine if, based on the interview and all the supporting documentation, you are eligible. Okay. You will receive a decision letter. So whether you are eligible or not for DD services, you will get a decision letter. Now, if you are eligible, you'll receive an annual an annual budget based on all the information gathered. Okay, and again, page 9, is it 9? Sorry, page 11 of the Road to Transition Guide goes further into detail on the process of completing the assessment and getting a budget. Okay, I'm going to move on. I'm going to skip to page 14. Again, we are just touching on the most important points. Okay. Now let's assume that you have submitted the application for DD services, you have adult Medicaid now, and you are eligible for DD services, and now you have a budget, right? Now that you have a budget, what can you access? There are different options that you can access. The first one we're going to talk about is state plan. You'll hear it refer as state plan. It's called State Plan Home and Community-Based Services, or HCBS. Under this plan, you have access to plan development and service coordination. So a service coordinator works through an agency. The way that works is you choose the service coordination agency from a list that we can provide. Once you interview with the agency and you decide you are going to go with this agency, at that point, you can choose a service coordinator. Now, something to keep in mind is that you should never be assigned a service coordinator. It should always be your choice, okay? You should always have options. Another thing that's available through state plan is developmental therapy and crisis intervention services if necessary. Now, some individuals have higher needs and may meet a higher level of support to qualify for the DD waiver. Now, under the DD waiver, we have two options. We're going to talk about traditional services first. So under traditional services, you have several things available. And under traditional services, you have access to state plan services. So service coordination, developmental therapy, and crisis intervention. But you also have access to residential habilitation, whether that is through CFH. And I know that the Department for Certified Family Homes will also be doing a presentation tonight, and they'll go into detail about what Certified Family Homes is all about. So residential habilitation, CFH, or supported living agencies are available through the traditional service waiver. Short service, respite care. Respite care is only available for someone who is not a paid provider to you. So for example, CFH, they're paid. The CFH providers are paid through Medicaid, so they would not have access to respite care. But if you are not getting paid, you would have access to respite care through the traditional DD waiver. Supported employment, environmental accessibility adaptation. So an example of that would be a ramp for a wheelchair. Specialized medical equipment and supplies. Personal emergency response system. Home delivery meals. Again, this service is not available if you're in a CFH, because a CFH will provide 3 meals a day. Under the traditional DD waiver, you are also eligible for skilled nursing, or you have access to skilled nursing, behavioral consultation and crisis management, and non-medical transportation. So those are examples of services available through the traditional option. Now we're going to talk about self-direction. Under self-direction, you do not have access to state plan services. The way self-direction works is you, the participant, are the employer. In other words, you're the boss. Participants and parents or guardians complete a self-direction training. This training is offered online now, which is, but it's nice. You don't have to go to an office or to a conference room to complete this training. You can do it just like we are tonight online. Under self-direction, we would hire, not we, you would hire a support broker instead of a service coordinator. So what they do is they write and they monitor the plan. Support brokers work independently, so not through an agency. A support broker, in order to become a support broker, they must complete training, pass exams, and be certified to become support brokers. Under self-direction, with the help of the support broker, participants create what we call a support and spending plan. That includes hiring your own community support workers and or buying goods and or services. Participants get to choose and hire their own staff that work one-on-one with them. Okay, so those are the two main differences. Self-direction, you have more control of your budget. You hire who works for you. You are the boss. Traditional services, you hire or you have access to services who are pre-approved by Medicaid. So in a nutshell, that is the Road to Transition Guide. I know it was just a brief description of the services. So again, please take the time at your own leisure to read through the Road to Transition Guide. It does go over information that is very important in more detail. Okay, so now that we talked about the Road to Transition Guide, I'm going to move to the actual application. You guys should have access to the application packet. The packet itself goes over examples of what you can submit for supporting documentation. It will give you description of the different options, but right now we're just going to go over the application itself. The application we're going to go over tonight is the most recent, most current one, recently updated. Let's just go over it very quickly. So on the top of the application, this little box here, that is for staff, department staff, so don't do anything with that. You're going to put the name of the applicant, date of birth, current address. Please include your city and zip code as well, so complete address, complete phone number, best phone number to reach you. Current living arrangements. So are you living with mom? Are you living with roommates, mom and dad, grandparents? Make sure you write that. Referral source, you don't have to fill that in. That's not important. Whether or not this applicant is currently enrolled in Medicaid. So even if when you submit the application, even if they're still under Children's Medicaid, go ahead and check yes, and then write the Medicaid number. I'm not sure if you're aware, but when you have Medicaid, your Medicaid number never changes. Even when you transition from children's services to adult services, the Medicaid number will remain the same. So you can go ahead and include the Medicaid number they currently have if they do have Medicaid. You want to make sure that you select a service, right? So are you wanting DD waiver self-direction? Are you wanting traditional services? And again, remember, this includes state plan. Or are you only seeking basic state plan? Make sure you select one. Now, if your if you as the applicant, if you qualify for DD waiver, keep in mind that if you choose an option when you submit an application, you're not tied to that option. If you feel that the option you selected is not working, say you're on it for a year or two and it's just not working and you prefer to go, I don't know, if you start with traditional and prefer to go self-direction, or you start with self-direction and want to try traditional, you can do that. You can do that. You would have to submit a new application, another one just like this one, but you can go from one program to the other. Make sure you write the family member or contact, their address, email, and phone number. A lot of applicants who are transitioning to adult services may not have a legal guardian quite yet. A lot of are in the process. If that's the case, you can leave this blank. If they're underage, technically you're the guardian, right? The parent or legal guardian, they have one, but you don't have to fill it in because again, you're applying for adult services. That's it. This is the application in a nutshell. Along with this application, again, you want to submit supporting documentation. So most recent history and physical. And by most recent, we mean anything it's been completed within the last 365 days. So within the last year. Documentation of disability. Okay. You want to make sure you submit those documents. And you can submit it by second page of the application will tell you the different regions, our phone numbers. You can submit it through fax, or you can email it to this email address. We are region 3 and 4. We service both regions. And you can submit it by email, no problem at all, or fax, or you can even drop it at our local office in person. All right. Now that we've gone over the application, I will tell you how to get a hold of us. So there are currently 4 quality assurance specialists in serving region 3 and 4. So that's Ada County, Canyon County, and the surrounding the towns surrounding Ada and Canyon, including McCall and Mountain Home. We have Andrea Stewart, and there's her contact information. Yada Yancey, and that's her contact information, and of course my contact information. We recently hired a new QA, so it'll be 4 of us. We're currently working on getting her set up with a phone. So Taylor Miner, she is another QA. But if you have any questions about any of the information we went over tonight, feel free to reach out to any one of us. We will be glad to answer your questions. And I hope you guys found this presentation informative. And again, feel free to reach out to us if you have any questions. I don't know if we have time to answer any questions, but if we don't,